U.S. Department of Health and Human Services will now recommend fewer vaccines for most children, according to health officials. Atlanta News First, Yasmina Alston is live for us in Dunwoody tonight. Yasmina, you asked a doctor about all this today.
That's right, and the doctor I spoke with says it is very concerning and parents should still consider following the guidelines set by the American Pediatric Association.
U.S. health officials announced Monday they are dropping the number of recommendations for vaccines they recommend for every child. This is effective immediately, which means the Centers for Disease Control and Prevention will not recommend vaccinations against RSV, hepatitis A and B, or the flu, and some forms of meningitis. Those will only be recommended for certain groups who are high risk or if their doctors recommend them. We spoke with Metro Atlanta primary care physician Dr. Duval Desai, who says it is concerning and parents should pay attention.
I think first and foremost, they need to do what's right for their child. They want to look at their child and ultimately think to themselves, I want my child to live a long, healthy life. I want to follow the American Academy of Pediatrics, the vaccine schedule, talk to their pediatrician.
There will still be recommendations for measles, polio, tetanus, whooping cough, HPV, and chickenpox. But medical professionals say this recent change puts kids at risk because vaccines are important.
Fundamental vaccines are about disease prevention. We have ways to prevent these diseases which historically have been catastrophic to kids, causing death, causing complications.
And he says this is especially concerning during a high flu and sick season. Live in Dunwoody, Yasmina Alston, Atlanta News First.